Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Okay, so some fun things have been happening around here, and I thought I'd jump in and do a solo episode for you so that we can talk about all the things that's going on. I hope you are well and that your clinical day is improving by listening to this podcast. Hopefully, the guests we're bringing you are giving you some amazing things to think about and other strategies to bring into your clinical day. So, did you know that Charting Champions is turning 5? We've just had our 5th anniversary. October 2020 is when I launched the Charting Champions program. And I wanted to give you some background about what was going on, why it was created, and what we do inside. So back in the 2018 kind of zone is when I was really struggling with getting home with my day complete. As a family doctor working 15 years in the system in both Australia and Canada, and I'm still not getting home with my charts done, my notes done, coming in on the weekends or working in the evening to get the day's work done. And it was really taking a toll on my health and on my ability to be a parent at home. My eldest at that time was in grade 10, and I remember distinctly one of the days, him sitting on the couch with dad talking about university ideas and plans for his life, what he wanted to do, and me on my way to my study to do more paperwork. And I was just miserable with the idea of missing out on his last 2 years at home. So that was one of the really painful reasons why I wanted to make a change. And then I was on my way to a medical student orientation weekend, where as preceptors, we are asked to do some sort of teaching for the students. And I wanted to be a more motivational speaker. And so I popped on Spotify a podcast and I asked Spotify to find me a motivational speaker, and up popped a life coach. I hadn't really heard of a life coach before. I was kind of curious what this all meant. And I had a 5-hour drive ahead of me. So I started at episode 1 and I got 5 hours in, and my mind was a little bit blown. I'd been showing up to work feeling dread and miserable, really angry a lot of the time if I was asked by the advisory team for quality improvement to add just another thing, mark off if they're a smoker or find out how many drinks they have a week. And my brain would just be constantly saying, you don't know how hard I work. You don't know what it takes to do this job. For you, it's one more click. But for me, that feels pretty mighty in terms of the ask, and pretty misunderstanding of what I have to do in my day. To be asked to do literally anything else is too much right now. And so on the way to this orientation, I was hearing things like, you can do impossible things. You can make changes in your life, even without the external life changing. You can start feeling better. And I just didn't, one, believe it. It felt impossible to me that I could be having a better experience of clinical medicine right now. I would say out loud, you don't understand what it takes to do my job. You don't understand the demands of my day. You don't understand the paperwork and the administrative burden. How could I possibly learn anything from you? But at the same time, I'm learning amazing things like joy is an inside job, and it's not your job's job to make you feel good. That's your job. No one else will respect your time. That's your job. If you want different, you can go and create it. And so with that knowledge, 5 hours of driving, I was feeling a little bit inspired to start to take what she said a little bit seriously and think, just because the external factors are happening, the story I'm saying about it is what's creating my feeling about it. And so when I'm feeling mad, it's because I'm thinking they don't understand what I put into this job. but can also be so thankful to myself for congratulating myself on what a good job I'm doing despite the demands, and feel just that little bit less angry or salty about it all. It was a minor, tiny step, but it did start making a difference in my day when I got back to clinic. I said, I'm going to see what parts of my day I do like, where I do find joy, where I can have a laugh, what I am enjoying about this, even though there's a lot I'm still not enjoying. And I did not have any idea how to make the paperwork problem go away at that point. It was just starting by feeling a little better within my clinical day. And we've talked a lot about that in the podcast, how to take the external factors and the story that we're making it mean and how that's making us feel, and start owning that and having some different sentences and story about our day that can feel less painful. From there, as I started to feel a little bit better and less angry and frustrated at my job, I then started getting curious about this impossible things are possible idea, and started to make small changes in my day. Like, if I wanted to finish on time, how could I do that? If I wanted to run this consultation on time, what could I do differently? And I read all the things and did all the things and tried everything until I got the result that I wanted. It took a full 18 months to figure that out. What I wanted to be finished after the last patient with everything done, and to be walking into the house reliably and with everything done. So I wanted to be walking into my house about 20 minutes after the last patient, because I had a short commute, with everything done. That's all the notes and all the paperwork, all the inboxes completed. So it took me a decent amount of time to figure out all the steps that were going to take to get me there. And you know what happened? And you've heard this story before if you've listened to the earlier episodes. That gives you bucket loads of time. When you've been the type of doctor who's been coming home and working for an hour and a half to 3 hours at night to finish off the clinical day, and then spending a good chunk of the weekends either procrastinating or doing the forms and inboxes and charts that are left over. Think for me, it was around that 15 to 20 hours a week outside of the clinical day that I was spending doing that work to finish off the work of the week. And to suddenly, not suddenly, but intentionally and over time, get to the point that I was getting home after the last patient and with everything done. That gave me bucket loads of time. I could now sit on the couch and enjoy those conversations with my kids. Initially, it didn't actually feel all wonderful. It was actually quite restless to suddenly not have that mental load sitting around that I should be this or I should be that. I should be getting those forms done. I should be looking at that inbox. I should be getting those notes done. It all disappears. And suddenly your brain says, what do we worry about now? But then it became fun, like really super fun. It's like, what are we doing this weekend? I actually enjoyed that question for a change, rather than what is it going to take to get back to my office to get this work done? Became, no, what can we go and do? This should be fun. This could be fun. Well, I just felt so much better in my clinical day. I felt like I was more present for my patients because all of the work was being completed behind me. I could just focus on what's in front of me. Over the last, once I had got to that point of having bucket loads of time, I then wanted to try and help my colleagues, because of course you want to go and share that it's possible to be having a different experience of clinical medicine right now. And it's pretty difficult to share that message, but it's wonderful when you're experiencing it for yourself. So I popped a post into a Facebook group saying, if you needed help in your clinical day, what would you want help with? And all of the responses were around paperwork. I need help with my paperwork. And I just felt a little sink in my heart of, I finally got rid of this paperwork problem, and now they want me to go and help them with their paperwork. Ugh, that's the last thing I want to help people with, because that's the thing I hate the most. 15 years of hating paperwork, and suddenly they're wanting help because I figured it out. Of course they wanted help with that. So over the course of time, I started to really consolidate what it took to go from working 15 to 20 hours outside the clinical day to get the work of the week done, to moving towards getting home with everything done. What were the exact steps if I could consolidate the process to walk somebody from where they were to where they wanted to be? What was that exact formula to help them? And we started that process one by one, initially with family doctors. So family doctors would come in and say, I want to get home with my paperwork done. And I said, great, let's do it. My husband and I went on a holiday to rural Saskatchewan. My husband is a fisherman. He loves fishing. That's not what he does for an occupation, but that's one of his most favorite hobbies. And we were sitting in this cabin with no internet. I'd taken my notebook and I forgot a pen. So I'd actually found this stubby piece of pencil in the cabin. And I had a notebook. And he went out fishing for the afternoon on his kayak. And I sat down and I wrote out the 6 different steps that I would use that had helped me, that I would use to help colleagues in getting home with the work done. What were the exact 6 steps, 6 sessions to get someone from where they were, 15, 20 hours working outside the clinical day, getting the work done, to the point that they were getting home with the work done. And I still have those handwritten sheets to this day of what we would cover in session 1 and session 2 and session 3 and session 4 and session 5 and session 6. And we started with one by one family doctors coming in. And within 6 sessions, usually they were doing 1 session a week, maybe every other week. So you think within the course of about 12 weeks, they're going from this amazing amount of work outside the clinical day to going home with the work done. And we use this formula over and over and seeing great success, which is a success story in itself. That was 500 hours of one-to-one coaching, initially family doctors, and then I had a hem-oncologist say, me too, and then a respirologist or pulmonologist say, me too, and then a rheumatologist say, me too, and then the nurse practitioner said, if you can help them, you can help me too. And we kept working on these exact steps over and over, helping all of the different types of specialties that came to me and said, you can help me too. If you can help them, you can help me too. And we were seeing that success. The demand got so much that we couldn't keep up the one-to-one calls because, of course, I'm still working full-time in my clinical day. And I'm adding these coaching calls to before work and after work, and suddenly I'm feeling that same level of burnout of I'm never done. I'm fitting in 18 hours of coaching in amongst the full-time work. I'm going to have to figure this out in a different way. So I started looking at some of my colleagues who were doing coaching in a different way when they had more people than they were able to do one-on-one, and seeing what they offered and what their best offer was in order to help people who had big deal problems, like the doctors who were coming to see me. We knew the exact steps that we needed to help people get from where they were to where they wanted to be. But more than just the 6 sessions that they'd been doing with me, you then need to come back in and pivot if you are changing. So if you're changing your EMR, if you're now going to be coming back from maternity leave, if you're changing job, if you're losing a few doctors, if you're having to now teach medical students, there's other things that happen about our clinical day. So a one and done is fantastic to get the skill set of doing things differently about your clinical day. But then there's the ongoing changes that happen within our clinical day, as you well know. And so when I was looking at the different styles of program to offer, what I loved was the lifetime access programs, where you can join once and have ongoing access to the coaching calls and the expertise inside the program for when you needed to pivot, when you needed to come in and learn a new skill, or maybe you wanted to go slower. You don't want to try and get things done in a really tight fashion. You want to take your time and do little bit by little bit towards the goals that you want. And so that's what I had decided on for Charting Champions, is that it would be initially for family doctors. It would be a program that you could come in, join up, get your 6 sessions of concise, very well practiced strategy for your clinical day. And they were pre-recorded videos where you could come in and watch a video that went for around about 12 to 20 minutes of my best wisdom from having taught all of these doctors, the best wisdom for helping them get from where they were to where they wanted to be. And then have ongoing weekly calls where they could come in and get specific help for their specific area. If they're working in a team, they're working with little teams, big teams, many doctors, solo practitioners. Everybody's a little different in their clinical day, and you need that specific help to help nuance the information for you specifically within the environment that you work. And I wanted it lifetime access so that you didn't have time pressure. You weren't pressured to get it all done within 12 weeks. And you could come back if you needed a refresher, if you fell off the wagon, if you were coming back from mat leave, if you were going to be working in a new state or within a new payment model, how to adapt and change to the changing requests and demands of your clinical day. So we did that. And we launched in October of 2020, and we had 77 founding members. And I was pretty impressed that there were 77 family doctors out there who said, yes, please, I need this help and I need it now. And they joined Charting Champions and we got started. So inside the program, they had access to the foundational video modules, and they were how to see a patient, get that chart note done right now, how to lead the consultation so you can run closer to time, how to manage those inboxes, get the forms done, manage a backlog, and manage difficult patients. All the steps you needed to help you get and manage interruptions and distractions. We can't forget that one. The real core modules, and we wanted it concise. I know that you're so busy in your clinical day and you don't have time for hundreds of hours of core content. You need everything fast. So I intentionally set up the videos so that they would be concise, to the point, short, sharp, because you can have ongoing value with the calls inside the program. The core modules had to be snappy. So I did that intentionally so that in an hour and a half, you can go from the start of module 1 to the end of module 6, an hour and a half, and you're done. And we have that now on a podcast as well. So people often listen on their way to work. One of my members who found me at one of the conferences I was at said to me, I joined the program, and for the first 30 days, I only listened to module 1 video recording. So every day on the way to work, she listened to module 1, which is close the chart after every patient. She listened to that every day on the way to work, and that's all she worked on for the first 30 days, and she nailed it. 30 days later, she was seeing patients and closing charts. Amazing. She wanted to really narrow focus and just do one thing at a time, and she did, which is so valuable. So charting coach is a title that I found after listening to a podcast where I was listening to a lady who was working with heartbreak clients who had broken up with their significant other, and she was the heartbreak coach. And I'm like, interesting. I wonder what my title would be if I was thinking about what I did for my clients. And of course, charting and paperwork was what I do. So charting coach was born out of that podcast listening, and got some inspiration on how to kind of frame what I do. But then it's evolved. So over the last 5 years, we've worked with physicians well beyond family doctors. So inside the program, initially, like I said, it set it up for family doctors, but then of course, pulmonologists, rheumatologists, endocrinologists, obs and gynae, orthopedics, general surgeons, the full spectrum of doctors said me too. Another thing, within my career, I'd worked in the hospital environment and the emergency department. And so we're able to bring that nuancing to the information for our emergency department doctors and our hospitalists who join the program as well. So it's really expanded into all areas of initially North America, so the Canadian and US doctors who joined the program. We're really getting help within the specific environment that they work right now, with the number of patients they're expected to see, with the demands, with the teams they work with, and getting the help they needed in real time without making changes to the number of staff, the EMR, the number of patients they see. They were getting the help they needed. So we did more than just charting and paperwork, and it became truly that clinical day advisor. A clinical day advisor is somebody who can look at the demands of your day, how you're working within your day, and help give some ideas for strategy that you could try next, the next stepping stone towards creating a day that works for you, that gets the day's demanded work done within the time given. On to our helpers. So we have 3 just amazing assistant coaches in the program. Noelle Nelson came in early. This was one of the coaches who had also struggled in the area of clinical day and charting, and just such an amazing and well-educated clinical day advisor and charting coach. So I took the training that I had, all the preparation I'd done, and I taught it to her as a one-on-one, and found that experience really helpful to understand how I do the type of coaching I do to help doctors get a change in their clinical day. I was able to teach that to Noelle. Soon after came Malini Argo and Jacqueline, who are also amazing physicians. Malini is in the US and Jacqueline is in Alberta. And Jacqueline came to us because I was looking for someone who could turn the modules into French translation for our French Canadians. And Jacqueline is both a Canadian doctor and able to speak French, which was wonderful. So we got our modules turned into a French translation. And they said, well, hey, if you're working with family doctors anyway to help them with their clinical day, why don't you come and learn how to be a charting coach within our program? And that now Jacqueline's joined as well. So, and Dr. Malini is such a caring and wonderful coach. She's really helped physicians move the needle with regards to the frustrations in their clinical day, the agitation that happens as you're working in your clinical day, because again, from lived experience of being a physician within these health models that aren't caring for us, she has already done the work herself and now has been helping physicians within the program for more than 3 years. So these are really long-term and very highly valued assistant coaches inside the program that work as very strong clinical day advisors, and our members love them, which is super wonderful to have that support and continuity with your clinical day advisors and coaches as we do the coaching calls each month. So that's been wonderful. The next thing I loved is, as we started to see a lot more physician coaches coming online, because they'd also discovered this life coaching thing changes lives and makes everybody a little bit more happy and able to deal with the stresses and forces on them in their lives. I realized that there was things that I'm not the expert in that I'd love to highlight to the members. So as part of the membership, I had this expectation that we would have at least one guest coach every month, and that guest coach would come in to bring an area of expertise that I am not an expert in. We've had burnout coaches, ADHD coaches, executive function coaching, other ways to help make very strong medical teams. And you've heard a lot of these experts on the podcast, because I'll often have them come on the podcast and talk to me before they go into the program as a workshop. If you're on the email list, which I highly encourage that you get on the email list, you'll get an update about who we're bringing into the program each month, so that you can see where to find them and to find out information about them. And that's another thing you can join us for. We have a workshop usually once a quarter that if you're not a Charting Champions member, you can come to those workshops anyway, just as a one-time, to see some of the experts that we've had inside the program and the immense value that they bring beyond what the assistant coaches can do. These are fantastic experts from around the world who give other value, which is really amazing for our members. Okay. We have studied the members. So over the last 5 years, we now have 1,500 doctors inside the Charting Champion program and around about 200 nurse practitioners and clinicians inside the Smarter Charting program, which is our parallel program for our health professionals who aren't doctors. And that was brought out of demand, and we started Smarter Charting program in 2021 after we've had multiple inquiries of, can I join? I'm not a doctor, and this will work for me too. So we launched Smarter Charting as a way to help our nurse practitioner and other health professionals who are also looking for help with their clinical day. Okay, so we studied quite a few of our Charting Champion members. What we found was that the strategy plus the clinical day advisor was helping our members get home earlier. And I'm really looking forward to publishing this paper this year. We're just putting the final touches on it now. But what we found was a significant decrease in the hours spent charting, p-value of less than 0.0001, and doing clinical paperwork outside of the clinical hours was a p-value of less than 0.006, and no significant difference in the number of patients seen in a full clinical day. So that was exciting to see that we had less hours being spent and no significant difference in the number of patients. My understanding for the physicians coming into the program is that what they have chosen about their clinical day is for a reason. So the EMR they use, the length of appointment, while you may have full autonomy or you may have no autonomy, as in no choice on how many patients you see a day, nevertheless, you work within this system for a reason. You're still choosing to turn up at work. So how can we help you right now within the environment that you work right now without changing your EMR, the number of patients you see? How can we also help you get the work of the day done and get home without reducing patient number, without changing up appointments necessarily? If what is happening right now is the system that you need to work within, how do we make it better for you? Okay, so this is training and support that works. The doctors reported being more focused at work. So this is a p-value of less than 0.001. Feeling in control of the clinical day. Again, p-value less than 0.001. And rating their mental energy at work as higher. And that was also a p-value of less than 0.001. So we have statistical significance in feeling more focused at work, feeling in control of the clinical day, and mental energy at work as improving. Now that was very cool to see, that we're actually turning the tide on you feeling better within your work day. All right. Doctors reported an increase in their current quality of life. That's pretty hard to improve the quality of life of a doctor, you'd think. But we did. Statistically significant, a p-value of less than 0.001. A decrease in work-related dread, p-value less than 0.001. And feelings of burnout, p-value of less than 0.001. And thoughts of quitting due to administrative burdens. a p-value of less than 0.001. That was pretty incredible to see that our doctors had improved quality of life, a decrease in work-related dread, feelings of burnout, and thoughts of quitting due to administrative burdens. So I'm pretty proud of that as a finding from our pre and post study. So strategy plus clinical day advisor plus you could equal an increased quality of life. So reducing the time you spend charting and tasks outside of the clinical hours, increasing free time, and increasing quality of life. So I'm pretty proud of that. Pretty proud of what our members have been able to achieve within the program. Really proud of our clinical day advisors and assistant coaches. Very proud of the team in the background that helps coordinate all of the things we do inside the Charting Coach organization. And it's more than just the programs we deliver. So Charting Champions and Smarter Charting, for sure, the solid and longitudinal continuity programs to give that comprehensive assistance to our lifetime members. And they are rock solid, very happy with those programs and the members inside, the value that we give them. In addition to that, we also have backlog buddies because we realize that all the members who come into the program have a backlog. That might be incomplete charts. It might be a few weeks of inbox. It might not be very much. But for some of our members, the backlog is a very, very big and onerous mountain of incomplete work. At times, it's been a very painful experience where some of our doctors or clinicians have potentially even lost jobs from incomplete work or not meeting performance recommendations with regards to completing charting. But I just love that they've found their people, a non-judgmental space to be able to say, I have a backlog, and have people who understand what that means for them personally, and to hold no judgment when they come in and say, I need help. The number of times that you might mention to a colleague, or you might mention to a colleague that you're struggling with your inbox, and you might just get funny looks like, what do you mean you struggle with your inbox? You just get it done. For some of the doctors and clinicians, they don't struggle with inbox. They don't struggle with getting charting done. That's not the problem that everybody has. But for some of us, it's a massive multiple year problem that they've been having. Like I said, 15 years of difficulty getting this work done prior to figuring it out. You are not alone. So coming up in November, we are having a very special holiday preparation date. So if you go to chartingcoach.ca/holidays, you can sign up there. This is going to be about half an hour of strategy with regards to backlog management and an hour and a half of getting your backlog done with others. So having a friendly meeting with other doctors and clinicians who also have a backlog, and we're going to be doing that together on a Zoom meeting call. We will talk about some strategy with regards to getting ready to do backlog, and then we'll actually do our backlog together. So you'll have an hour and a half there where we work on, in one of the evenings, I think we're doing it on a Saturday evening in November, because we want to get ready for the holiday period at Christmas time. We want to help you start that process of getting that backlog done. We know that there's usually a big deal of hours required to get some of that backlog down before some of the big holiday events. And I know many of you just desire to have that real time off where you don't have a backlog following you. And we've done this work. This is one of the common themes that comes up on the call is, I don't know where to start. This is just so hard. I always just feel so much dread and shame and guilt when I look at my inbox and I just don't know what to do. and we talk them through these strategies to get the backlog started and get the backlog going. So we're going to do this together as a special prepping for the holidays, getting the backlog done. So I want you to go and sign up for that at chartingcoach.ca/holidays so that we can do that session together. If that's you, if you have a backlog, you have found your people. We would be delighted to help you, not just with strategy, but we're actually going to sit there and do some backlog together. That's cool, hey? That's cool. Nice to be able to do things together. Now that reminds me, if you have not gone and grabbed the backlog prep guide, we have a backlog prep guide that you can go and download. You just head to chartingcoach.ca. You'll see the freebies at the top, and one of them is the backlog prep guide. Go download that so you can have a look ahead of time if you're interested in the tips and tricks we use to help you get ready to do your inbox a little bit easier, a little bit lighter, a bit simpler, a bit more fun. So go download that backlog prep guide. We'd be delighted to share that with you as well. Now, we have backlog buddies sessions. So backlog buddies, throughout my career, I had said to many of my colleagues, I'd just like a pajama party with you all so I could do my backlog with everybody, right? A pajama party where we all turn up in our pajamas and we just sit working on our backlog all night. Nobody ever took me up on that. Maybe they didn't have a backlog like I did. But for many of us, doing the work alone is not fun. It is so onerous, so mixed with guilt and shame, restlessness, agitation, frustrated, hatred, all these feelings that bubble up when you're trying to do your inbox. You're like, oh, why? Is it ever done? It's never done. So frustrating that I wanted to have a way for you to have an easier option for doing backlog. So Backlog Buddies is a online 2 hours. We've got lots and lots of sessions you can sign up for where you're going to be in a space, a 2-hour meeting style to get your backlog done. This is something that if you haven't checked it out, go check out Backlog Buddies and get a session signed up. And you're in a meeting, so you know what time you're showing up. You know it goes for 2 hours. No one's going to disturb you because you're in a meeting. Well, I mean, that's not true. You may have things disturb you, like small children, animals. But hopefully it's going to overcome some of the dread, some of the delay in starting, wiping down the kitchen benches for the 15th time, putting on another load of washing, and literally anything else other than doing backlog. I wanted to give you a firm time to start, time to end space where you can get your backlog done. It's even more fun if you sign a buddy up. So if you say to your buddy, hey, I'm going to do the session Saturday morning, join up with me, we can do it together, then you can be on the call together to do backlog buddies together. And that's just a way to do some of that body doubling, which helps if you've got ADHD, if you're procrastinating, if you're just so unsure on where to start and how to do this. That can be a way to help you get your backlog done a little bit easier. All right, so again, this is our 5th anniversary special. So I just wanted to pop back in to the Facebook celebrations we had with our members. So I'm not going to mention names, but I wanted to give you an idea of what the members are saying about the Charting Champions program that we've been running for now 5 years. So thanks for giving me the strength to fight back from feeling overwhelmed and hopeless. My notes are much faster, good enough, but mentally and emotionally, I am much better. Now I am present with each patient, giving them full attention and care. I went from thinking I had to retire to remembering that I loved being a physician because now I have time to do other things in my free time. Coaching helped me identify other aspects of my professional life that I need to analyze and work for change. Thanks for the very practical tips. The next one, woohoo! I think I was one of the original 77. It's helped me stay in the curiosity zone and trying to find the right questions, constantly changing things up, which sometimes drove my staff bananas. I made a big career decision last week, and I had all the tools I needed to manage. This is about learning a process, tools to navigate challenges, because there will always be challenges. I wanted to keep growing professionally and personally and not feel stuck, restricted, or discouraged. And this program helped with that. Plus, the peer support is first class. It's really not just about charting. Thank you, Sarah and team. Next one said, I was lucky to have found Charting Champions in October 2021, and my life changed completely. I no longer chart in the evenings. I get today's work done today. It was hard to change old ways, but you coached me through it, and now my work life is sustainable. Thank you so much. I love these. I love hearing our members' stories. They bring me such joy and encourage you in your clinical day that it's not impossible. You can get change if you want it. You changed my life for the better. Thank you for your practical, calm, firm advice and encouragement. I only wish I had found you sooner, but I sing your praises all over the internet. Oh, this one, congratulations. I also think I may have been one of the first group. You 100% changed my work life for the better, and this carried over into the other areas of my life. Although I did pivot from family medicine to emergency medicine shortly after, the skills you taught me have stuck with me and I continue to use them. You are an angel. Ah. Grateful for you and your work to help us reclaim our lives and sanity. I was also one of the original 77. I enjoy listening to everyone's coaching as well as the didactic sessions that Noelle brings. It really does help to hear things in a different way, to know that we all have similar struggles and issues. I'm still working on becoming more efficient and closer to on time, but I know I have saved numerous hours by making myself do the notes most of the time after each visit instead of saving most of the notes until the weekend. I feel less easily overwhelmed and I'm more likely to set and maintain boundaries. I take micro breaks to breathe deeply when I start to feel anxious, and that helps me move forward instead of spinning into overwhelm like I used to do. I have more time to spend with family and friends and to do things that I enjoy, like art and exercise. I try to stay curious and creative, but I still struggle with trying new experiments to make further progress. Right. So they are some wonderful reflections from our group. I just wanted to bring those to you so that you can hear sort of what the members are still saying inside. As part of the clinical day advisors, just some of the things we talk about on the calls, we talk about all sorts of things. We talk about, I run on time normally, but when I have a student with me, things go a little haywire. That's one of the things we hear. We hear, I'm in the emergency department, it's busy and full. How do I start getting my notes done after each patient, especially when it's in a haphazard form in the emergency department? You're collecting the initial data, then you need to wait for investigations to come in, and then you're pulling it all together, and then you might need more tests, or then you might be ready to discharge the patient or admit the patient. And so you're doing things in a stepwise manner. Same thing with hospitalists. Hospitalists come in and say, how do I set up my day for success? I'm often pulled into the rounds with either the allied health or the medical team, and then I've got to go see my patients, and then I'm there for hours after I should have left because I'm still doing the notes, and we start to work on curating their day so that they're able to get it flowing better for them and they can be more close to done at the end of their shift. We talk about when patients come in and they have a list of things, and that's pretty common, that we don't have hugely long appointments and we have patients having difficulty with access. And when your next available appointment isn't for 2 or 3 months, the patients in front of you are going to be waiting longer. So they'll have more things to discuss. And it's often not the easy, I just got an ear infection this week kind of talk, is it? We start to navigate, how do we use our time more wisely? How do we look at every minute and second within the consultation and start to do things in a way that gets us the best value for the time we have, and perhaps deflect and defer some of the requests in the room, knowing that everything we say yes to has a timed consequence, and we just don't have the time to do all of the things the patient needs today. So what else is available? Who's in the patient's medical home? Who else could be seeing the patients between visits? How can we use our team more wisely so we're not having to see patients as often through the year? We've had some really good changes in some of the patient medical homes where the nurse might see a patient for the blood pressure management, or the chronic disease nurse might see them for their diabetic review twice in the year. So the doctor's only seeing them 2 times a year instead of 4 times a year for their diabetic management. So there's infinite possibilities when it comes to how we set up our clinical day, how we interact with patients, how we do our charting, how we use our teams. And that's what we keep in mind, is infinite possibilities. Now what? What do you think is the next easiest step for you? The next thing you could do differently to help get you closer to the work of the day done? Inboxes is a really big deal. We talk about inboxes a lot. How we navigate patient portal messages. Are you the first person to see everything? Is there anyone else in the team who can get between the patient and you so that some of those things are looked after on your behalf? Looking truly at what is physician clinician work and what is not physician clinician work, and how to get that out of your inbox forever, or get that interruption out of your life forever. Who do you need to go and give permission to teach, train, so they can take care of that and you don't have to be doing that work? That's not for you. Where are we going to get this inbox work done? Some of you are now being paid to do administrative work after hours. So thinking British Columbia, Nova Scotia, and Alberta, now there is a hourly rate when you're doing administrative paperwork. Now, sometimes there's other conditions, like you need to have averaged a certain number of patients in person for the hours that you're claiming. But other provinces don't have that. So if you're working between 10 and 11 at night emptying your inbox, you're actually getting an hourly rate for that, for better or for worse. My argument would be, but do you want to be working between 10 and 11 at night to do your inbox? I'm going to suggest probably not. So even though we're maybe getting paid to do the work, then do we want to be doing the work then? And if you don't want to be doing the work, then how do we do that work within the clinical day hours? How do we set you up for success? How long does it take you to do your inbox? How do we do everything with less clicks, less words, less steps, so we can get everything faster, so we're not taking as long? We literally do not have 8 minutes to go checking through a patient chart to see what to do with that result. We simply do not have the time. So how do we start to do things in a different way? So these are things that come up on the calls frequently that we talk about, and we help you navigate them. We help you really dive into what's the strategy that's going to work for me. What do I need to do in my day a little differently with myself, with my team, with my patients, to make things just work better and be more smooth tasked through the day? Well, hopefully this has given you some ideas on what this is all about, why we're celebrating 5 years, and why we're so proud of Charting Champions and the Smarter Charting program, why we're so proud of the work that we do, and how we help physicians and clinicians change up their clinical day and have a different experience of clinical medicine. Now, if you're interested, we have the live masterclass coming up. If you go to chartingcoach.ca, at the very top, you'll see there's a title, join the next live masterclass. Click on that and join in. We'd love to see you there. In those masterclasses, I really go through those major 4 foundational steps: how to close your chart after every patient, how to lead your consultations, managing interruptions and distractions, and doing some of that inbox work. We talk about that on those masterclass calls. So you are always welcome. If you've been to one before, come again. Why not? Come on in. Take advantage of our birthday bonuses. So we're having a orientation call coming up in November. So if you are joining the Charting Champions or Smarter Charting program this month and in November, you'll be invited to that, where we're going to have a 2-hour session of really trying to dial in those very early foundational steps of seeing the patient and closing the chart, and managing that consultation so that you can run closer to time. So if you're interested in joining the programs, now is a fantastic time to do that. We have those birthday bonuses happening for you right now. So we'd be delighted to have you in the program. There's no obligation, no hurry. It's always open. You can join when you're ready. And when you join, you become a lifetime member. So there's no ongoing cost. So join now, and then you can have that ongoing access and all the previous recordings from our guest coaches and from our coaching calls. So we try and make this as easy to navigate as possible and at a time that works for you, and do it at your pace. And we just are delighted and so proud of the members inside the program, our assistant coaches, my staff and team who are doing such incredible work behind the scenes to bring this all together. So have a wonderful rest of your week. Thank you so much for being here on the podcast. Please share this podcast or put a like or review. And when I read out those reviews, I love to have a one-on-one call with you. So I'm going to be bringing those in. So leave a review because we choose one and then we tell you to get in contact with us. We can do that call. So that would be wonderful. So share with a friend who you think could be helped by this as well. Thanks so much for listening. Have a great week. Bye. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.